Welcome to the Sex Science Podcast, where we turn the latest peer-reviewed research on intimacy and sexuality into fun, accessible conversations. Generated by AI and fact-checked by experts, the Sex Science Podcast was created by Lancet to empower you through knowledge. So, join us as we explore pleasure, relationships, human connection, and everything in between.
Welcome back, everybody. Today we're going to be doing a deep dive that I'm really excited about. It's all about how we understand sexual well-being.
Oh, yeah.
Especially when it comes to public health.
It's an important one.
Absolutely. And you actually sent over some research from the Lancet, and it really got me thinking.
Yeah.
It's a viewpoint piece, and it lays out a pretty bold new model.
Yeah. It really challenges that, traditional kind of limited view of sexual health.
Right.
That I think a lot of us are familiar with.
Yeah, it's like, you know how the WHO has that definition of sexual health?
Yeah.
That was pretty groundbreaking.
Totally.
It talks about, rights, safety, and even pleasure.
Mm-hmm.
But the Lancet argues that it still mainly focuses on
avoiding the negative stuff.
Yeah, avoiding the negative stuff, like disease or unwanted pregnancies.
Right. And as this viewpoint points out, that focus on risk really misses a huge piece of the puzzle.
I know.
And they actually say this, and I'm quoting here, "Health is seldom, if ever, the primary reason for engaging in sex." It really makes you realize just how much more there is to consider.
That's such a good point. Why do we have sex?
Yeah.
It's not to avoid getting a disease.
Right.
That's not top of mind.
Yeah.
Okay, so this Lancet piece is saying we need to broaden our perspective.
Yes.
To include this concept of sexual well-being.
Yes.
And they're not just talking about adding it to the list of sexual health concerns. They're saying it's a completely separate idea.
Right. And that distinction is key.
Really?
It really helps us understand that fostering a positive and fulfilling sexual life requires more than just preventing bad outcomes.
So how does this model actually work?
So they've identified 4 key pillars. We have the traditional sexual health, of course,
right,
but then also sexual pleasure, sexual justice, and then sexual well-being itself.
Gotcha. So I'm starting to see the bigger picture here.
Yeah.
But what makes this concept of sexual well-being so different?
It's all about taking a more holistic view. This viewpoint breaks down sexual well-being into 7 specific domains.
Okay.
And each one touches on a different aspect of a person's sexual life that contributes to their overall sense of well-being.
7 domains.
7 domains.
Wow. Okay. Can you give me an example?
Yeah.
What kind of thing are we talking about here?
Absolutely. One of the domains is resilience in relation to past sexual experiences.
Oh, wow.
And it acknowledges sexual trauma and emphasizes the ability to cope and heal.
Yeah.
It goes beyond just avoiding harm in the present.
Right. That's so important. It sounds like this model is really trying to create a more nuanced and supportive approach to sexual well-being rather than just focusing on the negative stuff.
You got it. It's about empowering people to have positive and fulfilling sexual lives.
Yeah.
Across all these different domains.
So tell me more about these domains. What are the other 6?
Okay, well, in addition to resilience, we have sexual safety and security.
Okay, so that's like feeling physically and emotionally safe during sexual experiences, right?
Yes, exactly.
Yeah.
It's about feeling protected and being able to trust your partner. And then there's sexual respect, which is all about recognizing the rights and autonomy of every individual, regardless of their sexual identity or preferences.
Yeah, I'm already seeing how this model could have some real-world impact. Thinking about, sexual respect in a public health context could mean tackling things like sexual harassment or advocating for the rights of marginalized groups.
You're already getting it, and that's just 2 of the domains.
Wow.
So we also have sexual self-esteem, which is about feeling good about yourself as a sexual being, accepting your body and desires. Then there's forgiveness of past sexual events.
Okay.
Which is obviously a sensitive topic,
Yeah.
but it focuses on healing and moving forward in a healthy way.
Forgiveness after experiencing trauma, that feels like it could be incredibly powerful for someone's well-being.
Absolutely, and it highlights how this model takes a broader view than just focusing on avoiding risks.
Yeah.
Then we have self-determination in one's sex life, meaning feeling empowered to make your own choices about who you're with, what you do, and how you experience your sexuality without coercion or pressure.
Right. That seems like a core element of well-being in general. Like just having agency over your own life.
Right. And then finally, there's comfort with one's sexuality.
Okay.
Which is all about feeling at ease with your sexual identity and preferences.
Yeah.
Being able to explore and express yourself freely.
Wow, so this model covers a lot of ground.
Yeah.
Like, it's really impressive how they've managed to create such a comprehensive framework.
And that's exactly what makes this viewpoint so significant. It challenges us to see sexual well-being as a fundamental part of human experience,
Right.
not just something to worry about when things go wrong.
I'm really starting to understand why you said this model was so bold. It's not just about adding a few new ideas. It's a completely different way of thinking about sexual well-being.
Exactly.
In the context of public health.
Yeah, and we haven't even gotten to the WHY of it all yet.
Right.
This Lancet piece makes a pretty compelling case for why this new approach is so crucial.
Okay, well, let's dive into that. Why does the Lancet think this model is so important for public health?
They lay out 4 main reasons, and to be honest, they're pretty convincing.
Okay, I'm intrigued. Tell me more.
The first reason is they see sexual well-being as a powerful marker of health equity.
Health equity. So that's about making sure everyone has a fair shot at being healthy, right?
Right.
But how does sexual well-being fit into that?
Well, it's about recognizing that certain groups face more barriers to sexual well-being than others.
Okay.
You know, we're talking about the impact of discrimination, violence, and lack of access to healthcare and information.
Right.
All of these things can disproportionately affect marginalized communities.
So this model is pushing us to look beyond just individual choices and consider the systemic factors that influence a person's sexual well-being.
Exactly. It's saying that if we want to improve sexual well-being for everyone, we need to address these broader social and economic inequalities.
Okay, that makes a lot of sense.
Yeah.
What's the second reason?
The second reason they highlight is that sexual well-being can actually act as a meaningful indicator of overall well-being.
Okay.
Think of it like a canary in a coal mine.
Gotcha.
If a large portion of the population is struggling with their sexual well-being,
Right.
it could be a sign that there are deeper societal issues at play.
So it's not just about sex itself.
Right.
It's about what that struggle might be telling us about the health and well-being of the whole community.
Exactly. It's a piece of the puzzle that can help us understand the bigger picture.
Okay, that's a really interesting way to look at it.
Yeah.
What about the third reason they give?
The third reason is all about data. The Lancet piece argues that this new way of thinking about sexual well-being can actually reveal trends that traditional sexual health measures miss.
Interesting.
It's about gathering more nuanced and holistic information about people's experiences.
So instead of just looking at rates of STIs or unwanted pregnancies, we're talking about getting a deeper understanding of how people are actually feeling about their sexual lives.
Precisely. And that can lead to more effective and targeted interventions.
That makes a lot of sense. Data is only as good as its ability to tell the whole story right.
Right.
Okay, so what's the fourth and final reason why the Lancet thinks this model is so important for public health?
This last one is big. They argue that incorporating this model of sexual well-being could actually reshape the way we approach public health altogether.
Wow, that's a pretty bold claim. What do they mean by that?
Well, it's about moving away from a top-down approach and embracing a more collaborative model that recognizes the inherent value and importance of sexual well-being.
So instead of just telling people what to do, we're talking about empowering individuals and communities.
Yes.
To take ownership of their own sexual health and well-being.
Exactly. It's about creating a more equitable and inclusive approach to public health that truly meets the needs of everyone.
Okay, I'm seeing the potential here. This model really challenges us to rethink some fundamental assumptions about how we view sexual well-being.
Yeah.
And not just in like a theoretical way. It has practical implications for how we approach public health research, policy, and even healthcare.
It certainly does.
Yeah.
Of course, the authors of this viewpoint piece acknowledge that there will be challenges in putting this model into practice.
Like what kind of hurdles do they anticipate?
Well, one of the biggest challenges is figuring out how to measure something as complex and nuanced as sexual well-being.
Right.
Especially across diverse populations.
Right, because a one-size-fits-all approach probably won't cut it here.
Exactly. We need to develop tools that are both reliable and culturally sensitive.
Yeah.
And then there's the issue of resources.
Sure.
If we're serious about prioritizing sexual well-being, we need to invest in programs and initiatives that can actually make a difference.
Definitely. And I imagine there might be some pushback from people who aren't comfortable talking about sex openly, especially in a public health context.
Absolutely. There are cultural and societal barriers that we need to address.
Right.
But the potential benefits are too significant to ignore.
So even with those challenges, you think this model is worth pursuing.
I do. Imagine a world where people feel safe, respected, and empowered in their sexual lives, where they can access the information and support they need to make informed choices and cultivate fulfilling relationships.
It's a pretty powerful vision for sure, and this model gives us a framework for actually moving towards that vision.
Exactly. It's not a quick fix,
Right.
but it's a starting point for creating a more just and equitable approach to sexual well-being for everyone.
Well, this has definitely been a thought-provoking deep dive.
Yeah.
I'm really starting to see how this new model of sexual well-being could have a profound impact on the way we approach public health. So to bring it back to you listening in, we've been unpacking this new model of sexual well-being from the Lancet. And it's a pretty big shift from just focusing on avoiding negative outcomes, right?
It is. This model really highlights how sexual well-being is a positive force in our lives.
Right.
You know, influencing everything from our mental and physical health to our relationships and our overall happiness.
Yeah, it's making me think about how we often frame these conversations about sex.
Yeah.
You know, it's a lot of don't do this or be careful of that.
Right.
This model feels like it's flipping the script.
Yes.
It's focusing on what we can gain by cultivating a positive and fulfilling sex life.
You're hitting the nail on the head. It's about reclaiming the conversation.
Yeah.
And recognizing that sexuality is an integral part of being human. Something to be celebrated and explored.
Right.
Not just managed or feared.
And that reminds me of something you mentioned earlier about how this model could actually change the very foundations of public health.
Right.
It's not just about adding a new program here or there.
Right.
It's a much bigger shift in thinking.
It is. It challenges the traditional power dynamics of public health, where experts dictate what's best for people.
Yeah.
This model emphasizes collaboration and community engagement.
Yeah.
Recognizing that people are the experts in their own lives and experiences.
So it's less about telling people what to do and more about giving them the tools and the support they need to make informed decisions about their sexual well-being.
Exactly. It's about creating an environment where people feel safe and empowered to explore their sexuality and seek the information and care they need without shame or stigma.
I'm really starting to see the possibilities here, but I'm also wondering, what does this look like in practice?
Yeah.
How do we actually start incorporating this model of sexual well-being into our communities and healthcare systems?
Well, that's the million-dollar question, isn't it?
Yeah.
Yeah.
There's no single answer, but I think it starts with education and open dialogue.
Okay.
We need to break down the taboos surrounding sexuality and create spaces where people feel comfortable talking about these issues.
So starting those conversations at home, in schools, in doctors' offices, like making it clear that sexual well-being is a legitimate part of our overall health and happiness.
Absolutely. And it also requires us to rethink how we approach public health research and policy.
Okay.
You know, we need to invest in developing culturally sensitive tools to measure sexual well-being and fund programs that promote positive sexuality and address the root causes of sexual harm.
It's a lot to consider, but I'm feeling optimistic.
Me too.
This Lancet viewpoint has really opened my eyes to the possibilities, and I hope it's done the same for you listening out there.
I hope so too. This is a conversation that needs to happen on a societal level.
Yeah.
The more we talk about sexual well-being, the more we normalize it.
Right.
As an essential part of a healthy and fulfilling life. Well said. So to wrap things up, the key takeaway here is that sexual well-being is about so much more than just the absence of disease or risk. It's about fostering a positive and fulfilling sexual life across those 7 core domains we discussed.
Right.
It's about recognizing that sexuality is a natural part of who we are.
Yes.
And that everyone deserves to experience it in a way that's safe, pleasurable, and affirming.
Beautifully put. It's a journey, not a destination.
Yeah.
And it requires ongoing effort from all of us.
I love that. A journey, not a destination. And I think that's a perfect note to end on.
I agree.
So a huge thank you to you for sharing your insights on this important topic.
It was my pleasure. Thanks for having me.
And to you listening out there, we encourage you to dive deeper into this research.
Yeah.
Thanks for joining us on this deep dive into the world of sexual well-being. And until next time, keep exploring.
Thank you for listening to the Sex Science Podcast brought to you by LaShaw. We hope that you learned something new about the wonderful world of human intimacy and sexuality, and join us next time as we dive into more fascinating research. And remember, science is for you. Music for this podcast was produced by SoundRaw.